Miranda Rake.
And I'm Sarah Wheeler, and this is The Mother of It All, where we take on motherhood through the lens of culture and culture through the lens of motherhood.
Hi, Mother of It All listeners. Welcome back to our series exploring the impact of the pandemic lockdown on parents and families. In part 1, Sarah and I discussed the results of our survey of almost 500 parents about their experience of parenting through a global pandemic and the ways in which those intense years continue to impact them and their families now, 5 years later. All month long, we're sharing conversations with a few of the survey respondents who had particularly striking or emblematic stories to tell. Today, I'm talking to Brett, a doctor and mom of 2 in a small town who spent much of 2020 pregnant with a young toddler at home while caring for patients sick with COVID. Hi, Brett.
Hi.
I feel like we should just mention that we know each other.
Yes, since 3rd grade.
Since the 3rd grade. So there is probably some preferential selection at play, but also as I was reading people's responses, I flagged your responses before I noticed who it was. So I wasn't looking closely at the names. I was just like, oh, this person said interesting things. And I was like, wow, this person had an interesting experience. And I was like, oh, wait.
I know that person.
I know that person. So you are a doctor.
I'm a doctor.
You were working full-time in 2020.
I was working full-time. Yeah.
And something that struck me right away was writing about finding childcare that year. You write, we had a series of cobbled together arrangements and trade-offs. Preschool opened again, but closed frequently due to COVID exposures and cases. And it caused a lot of stress and tension in your home and in your marriage. And you wrote, I remember being pulled in 1,000 directions.
Yeah. Yeah. It was, I think, at the beginning of the pandemic, when preschool closed, we decided to form a pod of preschoolers and have a series of babysitters, and then that fell apart. And I was working full time. And for me, that means teaching residents in clinic, seeing my own patients in clinic, sometimes real life, sometimes virtually. And then also intermittently sort of working in the hospital. And
yeah,
that's a lot without the pandemic, with stable childcare. And then, it was just feeling trying to make things equal with my spouse as far as childcare, but then sometimes there was, the equalness was a complete illusion because I was working, sometimes 12-hour shifts in the hospital, and it can't be equal when that's the case. And then at other times trying to make up for that, but also still having to fulfill my job responsibilities. I don't know if I put it in the story, but I remember this one afternoon where our clinic had something where we had to sort of be on call for patient phone calls because the nurses in the clinic were getting overwhelmed. And so I was home trying to answer patient phone calls. And this was a brand new thing that our clinic was doing. And they had just sort of dropped this on us as this is a thing that you have to do now. And so I had sort of a surprise need to do that in an afternoon when I'd agreed to watch our 3-year-old so my husband could get some of his work done, and trying to answer this woman called, and she was I'm going through alcohol withdrawal, which, if you don't know, can be deadly. I broke my leg. and I think I have COVID.
Oh, gee.
And I'm like, I don't know that there's anything I can do to help you. And meanwhile, my husband's like knocking on the door, like, I have a work meeting. I need you to like be with our 3-year-old. And that
I'm
was
like having anxiety just hearing about
yeah.
it.
Yeah. So I'm trying to fulfill my, home responsibilities and, do whatever the best thing I can do for this patient that's on the phone, and she's having several real life crises at the moment. And that's just one example among many of the sort of amount of juggling that year required. And I think I was probably pregnant at the time.
I was going to say, so also in 2020, you, like me, gave birth in 2021.
Yeah.
Which means that we were those adventurous people who decided that 2020 was a great time to grow a family. And
I mean, what else are you gonna do?
I mean, right. We waited a little bit and then I was like, I mean, life goes on, and I'm getting older, and hey,
yeah.
So how was it though, managing pregnancy as a primary care physician in 2020?
Yeah, it was, I mean, I don't want to pretend that I was on the front lines or was working like the way that, say, an emergency room doctor in New York City was working. Like we were pretty insulated from the pandemic in our like little mountain town, and had like our COVID rates were just not the same as they were in big cities. So that was one thing that made it a little bit easier.
Yeah.
And as, a primary care doctor, I could do a lot of appointments virtually. But, there are just certain things where you actually need to lay eyes on the patient and see them in clinic. And it also turns out I found out that I absolutely hate practicing medicine over Zoom and over the phone, because you get so much more information about patients when they come into clinic and you can see them and touch them and listen to their hearts and lungs.
Yeah.
And then I was also working part-time as a hospitalist, which is a doctor that is kind of a general medicine doctor that takes care of patients when they're admitted to the hospital. And so there was certainly a lot of COVID circulating in the hospital, and most of the time as a pregnant physician, I actually didn't have to see very many COVID patients, but it was still, you're going into the place where all the COVID is. I didn't have a vaccine, obviously, at that point.
Yeah.
Because I had my daughter in very early 2021, and that was, I think I had 1 dose of the vaccine at the very end of pregnancy and 1 dose immediately after she was born. And so for kind of the whole time of my pregnancy, I was basically unvaccinated and having a lot of COVID exposures. And
yeah, you wrote that you remember the feeling of your baby kicking inside of me while taking care of patients like dying of COVID in the hospital.
Yeah.
That must have been a trip.
Yeah, it was really wild, and it felt like just a year of so many contradictions and so much so much anxiety. Like I'm feeling my stomach is like jumping, like thinking about that year. And so much uncertainty too, about, I think in the early days, we didn't we didn't know that lockdowns were going to happen, and we didn't know what the needs for health, for healthcare workers was going to be, and seeing, young, healthy physicians in Italy and China, dying from COVID. I didn't know if that would be in my future.
Right.
And
yeah.
Fortunately, nothing like that ever really happened at our hospital or in the town where we live, but it was there was just so much uncertainty about the pandemic and what was going to happen, and then there was this added layer of uncertainty about childcare, and at any minute the childcare rug could get pulled out from under us, and that happened time and time again throughout that year.
So I'm interested, I mean, we kind of touched on it, but in that tension between so much going on, so much anxiety, so much fear, but then really deciding to have another kid and keep going forward kind of in your home personal life. Do you think that was like, for me, it felt like there was this element of like wildness to it, like to the decision for us to try for another child. And I was like, I just felt like I needed that. I was like, I want to have like a hopeful act, or I want to participate in something joyful, or potentially joyful, hopefully joyful, and like keep living.
Yeah.
And that was my feeling, and I'm curious how that felt for you when you were.
Yeah, I think it very much felt that way. I think the feeling of wanting something hopeful out of all of this, and the feeling of like wanting to keep, I guess, moving forward, or keep growing our family in the way that we wanted to, felt like in some ways a totally irrational act, but also at the same time something that tied us to the future, something that we knew was going to bring joy to our family, even though the risks were higher. And I think it was also something else to focus on. Not like just the distraction of preparing for the baby, and everything that entailed, and getting like the anticipation of having a new baby, and that kind of carrying us through, and knowing that, well, things are really shitty right now, but we have to believe that they're going to get better.
Yeah.
Yeah.
Yeah. No, I mean, it felt that way for me too. It did feel a little crazy, but it also brought so much joy to like our extended families too.
Yeah.
Like, bringing them into this joyful, hopeful thing. And for like my parents, and just giving joy to a lot of people, where in a time when everyone was feeling so isolated and depressed.
Yeah.
It was like, baby, here's an ultrasound photo,
Yeah.
It's a girl.
Yeah.
So, well, how do you feel now, 5 years later? I mean, you mentioned that like just talking about it, your stomach is like, how is that time still with you and your children, or your, in your marriage and your life?
Yeah. I think in a lot of little ways, like every time I put on a mask at the hospital, we used to have these terrible, uncomfortable turquoise colored masks that had this, like the nose bridge didn't have enough padding. And that was essentially what I was wearing all the time for the pandemic, because that was like the best N95 that was available. And then around the end of 2020, maybe beginning of 2021, they came out with this new model of masks that fits so much better and is so much more comfortable. And it's such a silly, tiny detail, but every time I put one on, I'm like, oh yeah, I don't have to wear that other terrible one anymore. And I remember how terrible it was. And I remember some of my colleagues having, like, they would get like pressure sores and wounds from wearing the mask, the turquoise masks for so long. And they'd have all these elaborate like dressings and band-aids that they'd put on their noses to be able to tolerate wearing it all day. And yeah, and then the other day, my husband and I ran into the doctor that delivered our youngest baby at some school function, and my husband didn't know who she was. He didn't recognize her without a mask because he'd never been to any of my appointments. He'd only come to the birth, obviously. And so like every once in a while it'll be like this little nugget, or this little, I guess you call it like a shibboleth, like a little stone that you unturn from pandemic times that makes you recall that. And it's weird.
It is so weird. I mean, I think it is still lurking, I think for so many of us, and I don't know, I would think that in your profession it would be more like, oh, like as a group of people, we are traumatized and let's work on that or whatever, but I don't know if
we would never admit that. We're physicians, we don't have feelings, come on.
What hope do the rest of us have? If doctors are like, nah, process trauma, no. Yeah. I mean, I think, yeah. I guess this is how we process,
Yeah.
Talking to our friends.
Yeah. And I think I was out at a birthday dinner with some friends, and we were kind of reflecting on like different pandemic experiences and the sort of how it was experienced differently in different places. Some of our friends were living in bigger West Coast cities for some of the pandemic, and I was reflecting on how grateful I was that in our smaller town that nobody ever really felt like they had to wear masks outdoors. And outdoors was sort of this, it felt like there was a lot of freedom outside. And I think a lot of people experienced that too, that outdoors was where you could sort of let go a little bit.
Yeah.
And I was just talking about that with some friends and how grateful I was that, we sort of will always have the outside. And, that we never really, at least it wasn't the social norm to wear masks outdoors here. Whereas in other places, it most definitely was, and it was the expectation. And if you weren't doing that, then you were a horrible person. And yeah, just recalling things like that. It's really interesting how it played out in different places.
Yeah. Yeah. Here in Portland, in September of 2020, we had these crazy wildfires, and we lost the ability to be outside for about a week. And That's like the darkest I think I've ever felt.
Yeah,
where I was like, you took away
absolutely.
my one
That was the one thing.
place.
Yeah.
And I'm just literally inside my house, like taping up the cracks, you know, and you're like, ah.
Like standing over the air filter.
Yeah.
Yeah.
Yeah. Well, we didn't have a, you know, air filled purifier yet because it was our first wildfire experience. Now we have like 5, but
yeah.
you know, we learned. Well, and last thing, I think you participated in like vaccine, like when you got your vaccination as a pregnant person, was that part of a trial or?
No, it wasn't part of a trial, but then I think a friend had shared something online about looking, you know, that the CDC was looking for people to participate in a registry of pregnant folks who had received the COVID vaccine and or like immediately postpartum. And so I immediately signed up because I wanted to contribute to science, and also I feel really passionately about vaccines and how effective they are, and how I wanted to contribute to that. And so I signed up for this registry through the CDC, and they called me and did a pretty extensive phone survey and then they called me, I think, every few months for a year or so afterwards to ask for data. And that was really fun. It really felt like not only am I getting this vaccine to benefit myself and maybe pass some immunity to my baby, I'm also, you know, contributing to showing that it's safe for other pregnant patients to get it. And
well, it influenced me because I mean, I was desperate for my vaccine, but I was very pregnant when it was finally my turn. And I actually had what I now think is like a panic attack a little bit right after I got it. Yeah. Because I was like, maybe, I don't know, like 28 weeks pregnant or so. I was quite pregnant. Yeah. And I went and why did I go alone? You know, I don't know. I drove myself. I guess because David stayed home with Griffin, and I was like, oh, it's my appointment. Yay, this can only be good, you know, and then got there, and I did think of you because I had a little like, oh, is this going to be okay? And we had a complicated pregnancy, and and then I got my vaccine at the airport. Also, it was the most apocalyptic feeling ever. You're like in this giant line of cars and like this weird place. It's not for vaccines, you know? And then, and you're just like, okay. And you like stick your arm out the window. And then, so I definitely thought of you. I was like, okay, Brett did it. She had her baby. It's all fine. Yeah. And then I went to the 15-minute waiting place and freaked out. You know, I was like, waved my hand. I was like, I think my heart rate is high. And then they're like, well, it is really high, which I was like, don't tell me that. And then they're like, you're probably fine. I think I drank some juice. It was fine. Juice is almost always the answer. Yeah. Is that maybe a placebo? I don't know. No, a box of cold juice, man. Yeah. I agree. Yeah. It's really helpful. Well, thank you for your service. I'm sorry that was so intense. And I'm surprised I didn't cry. Me too. I was like expecting to cry, and I somehow managed not to. So I'm really glad. I didn't want to make you cry. Well, even if you did, it would have been okay. Yeah. Well, I hope that, you know, that doesn't happen again. Well, you'll never have a newborn in a pandemic ever again. I will never have a newborn in a pandemic ever again. And that's just so great. That is something I think about sometimes. I'm like, well, who knows what will happen, but that won't happen again. Yeah. Yeah, I know. It's with all the dismantling of public health infrastructure, it feels like it's almost certainly going to happen again. Yeah. Good thing I have 4 air purifiers now.
Yeah.
That will protect me.
Good thing we have the comfortable N95s now.
There you go. We've got that. I do have a closet full of masks. I think
Yeah.
whomst amongst us does not have a closet full of various sized masks. You know,
Yeah.
I don't know. Well, thank you, Brett.
Yeah, thanks so
Nice
much.
to see you.
Yeah, likewise.
The Mother of It All is produced by Opus Knox Media with music from It's Electric. If you liked this episode, why not send it to a friend right now? Go on, we'll wait. You can follow us on Substack at themotherofitall.substack.com, where subscribing will get you episodes and bonus posts in your inbox and connect you with the Mother of It All listener community. Plus, become a paid subscriber and get a hot off the presses Mother of It All canvas tote. We're also on Instagram at The Mother of It All, and you can email us anytime with ideas or feedback at motherculturepod@gmail.com.